Gentlemen, let's address a subject that many men, particularly those over the age of 60, tend to avoid discussing openly: masturbation. Although it is often regarded as a taboo topic, the truth is that masturbation is a completely natural and healthy part of human sexuality. It has been practiced throughout life, and for many men, it remains an important element of physical comfort, emotional release, and sexual fulfillment well into later years. As a urologist who has worked with countless patients in this age group, I can confidently say that masturbation after 60 is not only common but can also play a significant role in maintaining sexual and overall well-being. However, I must also emphasize that certain habits and techniques, which may have felt normal or even pleasurable in younger years, can, with age, begin to cause discomfort or lead to unwanted health issues if not adjusted. The aging body undergoes natural changes. Tissues become less elastic, lubrication decreases, sensation shifts, and recovery times are often slower. For this reason, how one engages in masturbation after 60 becomes just as important as the act itself. It is not just about pleasure, but also about protecting the prostate, supporting urinary and sexual health, and ensuring comfort and safety in the long run. From a medical perspective, masturbation offers several tangible benefits. For one, it relieves tension and stress, something that becomes increasingly important for men who may be balancing health concerns, family responsibilities, or the natural stressors of aging. Some studies also suggest that regular ejaculation may contribute to better fluid turnover in the prostate, potentially offering some comfort and reducing congestion, though the evidence regarding protection against prostate disease is mixed. Beyond physiology, there are also psychological benefits. The release of endorphins can elevate mood, reduce anxiety, and contribute to overall emotional stability. Sexual expression, even when solitary, is closely linked to feelings of vitality, masculinity, and confidence, all of which support healthier aging. That said, the benefits can only be fully realized when masturbation is practiced safely and mindfully. Unfortunately, I frequently observe three common mistakes among men in their 60s and beyond, mistakes that can lead to irritation, injury, or infection if not corrected. Let us take a closer look at each of these issues and the best ways to avoid them. The first and most frequent mistake I encounter in older men is the failure to use adequate lubrication. Natural lubrication diminishes with age, and friction without proper moisture creates an environment for discomfort and even microtrauma to sensitive penile tissues. These small injuries may not always be noticeable at first, but they can accumulate over time, causing irritation, scarring, or even conditions such as Peyronie's disease, which is characterized by painful curvature of the penis. The good news is that this problem has a straightforward solution. Make lubrication a consistent part of your routine. High-quality water-based lubricants are usually safe, gentle, and easy to clean. For men who experience especially dry skin or engage in longer sessions, silicone-based lubricants may provide longer-lasting moisture. However, men who use sex toys should remember that silicone-based lubricants are not compatible with silicone devices. Oil-based lubricants, while sometimes tempting, should generally be avoided, particularly with latex condoms, since they can weaken the material and increase the risk of tearing. A generous application of lubricant should be viewed not only as an enhancer of pleasure, but also as a protective measure for maintaining tissue health. And do not hesitate to reapply as often as needed. This simple act can prevent much discomfort and long-term complications. The second mistake I frequently see involves the use of excessive force or overly aggressive techniques. Many men develop habits during their younger years that involve intense pressure, vigorous stroking, or squeezing, as these methods may have provided stronger stimulation in the past. However, the reality is that after 60, these practices often do more harm than good. The erectile tissues of the penis, along with the tiny blood vessels and nerve fibers that contribute to sensation, are delicate structures that become more vulnerable with age. Aggressive handling can cause bruising, swelling, numbness, or even long-term nerve damage, which paradoxically reduces sensitivity over time rather than enhancing it. Instead of force, men should focus on gentleness and rhythm. Exploring slower, more mindful techniques allows pleasure to build gradually and reduces the risk of strain. Taking time to experiment with different motions and hand placements can provide new sensations that feel both comfortable and satisfying. Importantly, one must always listen to the body. Any feeling of pain, pinching, or sharp discomfort is a clear sign to stop and adjust technique. Pleasure should never come at the cost of damage or pain. By shifting the mindset from force to finesse, men can protect their sexual health and, in fact, often discover deeper and more enduring forms of pleasure. The third mistake, often overlooked, is neglecting proper hygiene immediately after ejaculation. Some men assume that because masturbation is a private act, post-activity care can be ignored or rushed. However, failing to clean properly afterward can create unnecessary health risks. Residual semen and lubricant, if left unwashed, can foster bacterial growth, leading to urinary tract infections. Skin irritation or persistent discomfort. This is particularly important for men with conditions such as diabetes or an enlarged prostate, as these factors already predispose them to infections. The solution is simple. Wash the penis and surrounding area with warm water as soon as possible after masturbation. If a cleanser is used, it should be mild, fragrance-free, and pH-balanced for sensitive skin. Harsh soaps or overly scented products can cause irritation and disrupt the natural balance of the skin. After washing, ensure that the area is dried thoroughly, since excess moisture can also encourage fungal or bacterial growth. These steps may appear small, but they significantly reduce the risk of complications and promote overall genital health. Understanding these three mistakes and adopting healthier practices is not just about preventing discomfort in the moment. It is about preserving long-term sexual function and maintaining confidence in one's body. By using proper lubrication, employing gentler techniques, and practicing diligent hygiene, men can support better circulation, protect nerve integrity, and minimize the risk of injury or infection. These habits form part of a broader strategy of self-care that respects the natural changes of aging while continuing to honor the importance of sexual expression. In addition to correcting these common mistakes, there are a few guiding principles I encourage men to follow. First, always listen to your body. Pain, numbness, or unusual sensations are not to be ignored. They are signals that something is wrong. Second, remain open to change. What felt pleasurable at 30 or 40 may not feel the same at 70, and that is entirely normal. Embracing new techniques or approaches allows for continued enjoyment without frustration. Third, remember that frequency is personal. There is no universal rule about how often one should masturbate. What matters is that it feels comfortable, natural, and satisfying for you. Some men may feel best with frequent release, while others may prefer less. Lastly, prioritize hygiene, not just after but also before the act, since clean hands and genitals reduce the risk of introducing bacteria in the first place. I cannot stress enough that while these practices provide a safe foundation, they are not a substitute for professional medical advice. If you experience persistent pain, bleeding, unusual discharge, lasting changes in sensation, or difficulty maintaining an erection, you must consult a healthcare provider or urologist. These symptoms may signal underlying conditions that require timely attention. Early diagnosis and treatment almost always lead to better outcomes. Ignoring these signs out of embarrassment or fear can allow minor problems to develop into serious ones. To summarize, masturbation after 60 is not only normal but can be a vital contributor to health and well-being. By avoiding the three major mistakes of inadequate lubrication, excessive force, and poor hygiene, men can continue to enjoy a fulfilling sexual life while safeguarding their health. Sexuality does not have an expiration date, and caring for oneself in this area is as legitimate and important as exercise, diet, or any other aspect of wellness. Ultimately, mindful self-care in sexuality reflects respect for the body and helps maintain vitality, confidence, and comfort well into later years.